The clock is ticking down on the deadline for people to sign up for medical insurance under the new Affordable Care Act. The deadline is March 31st, and it's at workshops like this in Orange, New Jersey, that local community partners and organizers are learning how to best reach the underserved populations in New Jersey. Reports say there are as many as 900,000 New Jersey residents who don't have any kind of health insurance. And it's a race against the clock, according to some of these organizers.
We have reached a significant part of that population, but we have there's really a long way to go. And what we've seen is that there's a real big push, and people are moving very quickly to get to enrollers and navigators and people who can offer them personal assistance to enroll. We're seeing a particular bump with our young adults.
Many of the underserved populations in Orange, New Jersey are composed of homeless, ex-offenders, and the unemployed, populations that are particularly hard to reach. But Wendy Sykes, executive director of Orange's Healthcare Navigator, says they are working 6 days a week to reach these populations.
And what we do as navigators is we assist individuals in educating them and assisting them enroll into the marketplace or the exchange. We use those two terms interchangeably, but we go out into the community. We work with faith-based organizations, community service organizations, and individuals, families, and we work with all different populations. The homeless population. We work in collaboration with healthcare clinics that deal a lot with the homeless population. The unemployed, ex-offenders. And so we educate them on the Affordable Health Care Act, on the ability for them to enroll into the marketplace, and we assist them in enrollment by everyone's case is different because your plan is based on your income, your household size, and things like that, and just what you choose personally for health care coverage. And we assist them in doing those things. What we do not do is we do not tell an individual which plan they can choose. We offer unbiased assistance to all of our consumers, and we do this Monday through Saturday, and we're really on a big push to really enroll as many people as possible and educate as many people as possible before the end of the open enrollment period, which is March the 31st.
Local political leaders say that reaching these underserved populations is critical to helping their towns with the burdens of costs associated with uninsured health care.
This is huge. We serve one of the populations that's traditionally been underinsured or not insured at all. We serve a population that has jobs where insurance may not be provided, or it may just cost us out. And so to have people to come into the field on the ground to come to our constituents, this is something absolutely wonderful for us.
We have a significant number of people who are uninsured. And so at the end of the day, you can't have a healthy community unless you have people who have access to health care. And so this is one way, the Affordable Care Act, which provides a vehicle for people to get health care and not fill our various emergency rooms up for their primary care, but gives them a vehicle to do preventive care and get primary care earlier before their health modalities become acute.
Many of the underserved populations these groups are trying to reach have language and cultural barriers, but the organizations say they're ready to deal with those issues with people who speak the languages of the different groups they represent.
We have a large Creole population in Orange, and we also offer help in Creole. We have a small Asian population, and we can get you help and assistance with Asian in your own language so that you're comfortable when you come to us and you completely understand what we're talking about and able to pick a plan confidently.
One thing definitely that's been in our favor is our language capacity, and being able to communicate and to provide the same educational information about the health exchange in a language that's more familiar has helped us enroll more people in the community.
In Orange, this is Steve Lubetkin for State Broadcast News.